woke up with a big toe joint that is red, swollen, on fire, you're not even able to handle the bed sheets?
That might be gout.
Yeah.
And then today we're going to talk about everything you need to know about it.
We'll go over what a gout attack looks like, why does it love the big toe joint so much, the diagnosis, but especially how to treat it.
Let's get into it. Hi, welcome back to the channel. My name is Dr. Blanchett.
And I'm Dr. Richard. We're board-certified podiatrists
And foot and ankle surgeon.
And before we start, please subscribe, like, all of the above. It really helps our channel.
It really helps out.
Sweet.
If you're watching this video, you've probably had a gout attack before, and I'm sure you don't want it to come back ever. Make sure you watch until the end because we're gonna share the gout-friendly diet as well as food to avoid. And so you don't have to take notes. We also made this free reference guide that you can grab down below. What is gout? Gout is an inflammatory arthritis caused by too much uric acid in the blood. This is called
hyperuricemia, the medical term.
Yes, and then what happens is that in some cases, the uric acid is going to precipitate and deposit into the joints, and it's going to cause a lot of inflammation and a lot of pain.
It can also deposit in the soft tissue as well. There's two main reasons why the uric acid will be high. The number one is under excretion. Basically, it's your kidney that don't clear out the uric acid enough. That's usually caused by genetics, some kidney disorder, dehydration, and some medication like diuretic or low-dose aspirin.
The other reason is going to be overproduction. So there's some people that are just going to produce too much uric acid. The main reason usually is due to diet rich in purine food, red meat, organ meats, and also in some people that have some type of cancer because it's going to be a high turnover of the cells.
The big toe joint is the most common joint to be affected by gout. And one of the reasons is because the uric acid crystallizes more easily in cooler temperature. And guess what? Your big toe joint is the furthest away from your heart, your core, where everything is warm.
The big toe joint is a smaller joint. So when the crystals are going to precipitate, it's going to be a smaller space, so then the crystals are going to irritate the tissue around it. Also, the big toe joint is going to be the joint in the foot that's just going to have a lot of pressure on it.
During stents, 40 to 80% of your body weight is through your big toe joint, and it's even worse while you go through propulsion.
The perfect storm.
What a gout attack feels like.
A gouty attack is going to bring patient to our office in a lot of pain.
Yeah.
And they're going to think that they broke their foot because they're in so much pain. They're going to bring their own crutches because they can't walk on it. All this without any trauma. So they're very puzzled.
It's a 15 out of 10 pain. Patients don't even want us to look at it. That's how painful it is.
The bed sheet is hurting. Like they can't have anything touching their foot because it really hurts. Whenever you look online, if you type, I have pain in my big toe, gout is always one of the differential diagnoses. You know it's gout because it
Horrible.
hurts. It hurts so much. People are gonna have like their toes gonna be super red, very swollen. Can't move it.
Yeah, it can be also warm. So it kind of looks like an infection, but it's not. There's no portal of entry. Often when they go to the ER or the emergency room, they come back having an antibiotics. But guess what?
Because people are like, oh, you have cellulitis. And then we're like, no,
it's not going to work. The antibiotics.
Yes.
Exactly.
Let's talk about the common triggers for gout.
Yeah, gout usually happens when the uric acid levels suddenly change. The common triggers are high purine foods like red meat, organ meat, liver, shellfish,
alcohol, especially beer and hard liquor,
dehydration,
sugar drinks or high fructose corn syrup,
crash dieting or fasting,
any trauma to the foot,
different type of stress or illnesses,
and also some medication like diuretics.
Do you have any stories of your patient why they had gout?
Yes, I have so many. There was one that was a little bit different. It was a patient that came in, and then he said that a few days before he went out with his family and he had 2 vodka martinis. Usually he was always having one.
Hard liquor.
And then also they ate a pizza with anchovies.
What? No. You can have like pineapple, but not anchovy on your pizza.
I love pineapple.
Yeah, me too. Anchovies can increase your purine.
Exactly.
That's it. Don't eat anchovies. Not on pizza.
How about you? Do you have any?
Oh, yes. The most common one I see is after holidays, right? Big meals, drinking a lot. Yeah, I'm sure you've seen it too.
All the time, yes.
Sweet. Let's go over the stages of gout. The first one is asymptomatic hyperuricemia. So that means you're gonna have high uric acid levels in your blood, but you're gonna be asymptomatic, no symptoms yet, no pain yet.
Then the second stage is when you have an acute gouty attack, what we just talked about earlier.
Before.
You're gonna have a very red, hot, swollen, very painful toe.
Then you have the intercritical gout. That's the calm between the storms. Your uric acid is still high, you have no symptoms, but the crystal continue to deposit throughout your body.
The last stage is gonna be tophaceous gout. Tophaceous gout is gonna be a debilitating chronic arthritis because all of those years that you've had deposits of uric acid inside the joints. And then the other thing else that we're gonna find is gonna be to have tophi, which is deposit of uric acid not only in the joint, but also in the soft tissue.
Yes.
And it can be all over the body. I actually had a patient, oh my God, I met him in the hospital. He had a gouty tophi on his big toe. That was draining. It was draining pus.
I've seen that.
And then we had to do an amputation. In his case, he was mismanaged for a long time. His primary care doctor was telling him just that it was just regular arthritis, just take ibuprofen. So he was taking always some anti-inflammatories. So he was killing his kidneys, and then he wasn't treating his gout. He had tophi everywhere. I tell you, like it was like on his nose, on his ears, on his hands, on his knees, everywhere. And
that could have been treated,
It could have been avoided completely. Yeah, so it caused a lot of issues in this case.
And in your case, it was superimposed infection. When the infection goes in the bone, then you need to have an amputation. Sometimes you cannot save it.
Now, how do we diagnose gout? The first thing is going to be clinical exam, basically history and physical. We're going to talk to the patient and ask, when did the symptoms start? Is there any medication that can precipitate gout? Was there any trauma involved? How much pain they're in? We're gonna look at the toe if it's a red, hot, swollen toe, and then there's no signs of, infection or nothing that could have caused an infection. Most of the time it's gonna be gout. And then we can also ask about family history as well.
Another test we can do is an arthrocentesis. It's usually the gold standard, and it's basically, to test the joint fluid. So the doctor take a needle, take some fluid from the joint, and then send it to the lab. And what we're gonna see is needle shape, negatively bifringent, urate crystal. So you don't have to know that as a patient, but as doctor, we do.
It's actually a board question.
Yeah, every exam.
Arthrocentesis is considered as the gold standard, but it's not always done for a few reasons. Because first of all, it's painful. You know, like you're already in pain and then you're gonna stick a needle in there. I mean, you numb the area first, but still that's another needle and then like a really swollen, really painful joint. The other thing is that it's hard to take some fluid out because it's such a tiny joint and then you don't have as much like fluid to take out.
Yeah, usually what I do for that is I inject sterile saline inside the joint. So all the cells mix up together. Yeah, and then you have something to
That's
take
a great
out
idea,
and send to the lab,
Yes. And then the other thing that we can do for diagnosis as well is going to be to send blood work. So basically, blood work, usually it's not going to show that the uric acid is elevated. And then that's something that's a little confusing sometimes for a lot of people. But the reason is because they're testing the blood, they're testing the circulating uric acid. But a lot of the circulating uric acid is depositing in your toe. It's going to be oftentimes negative, but it doesn't mean that it's not gout. Usually you can also rule out other causes.
Yeah, infection. The uric acid is usually going to be elevated about 2 weeks after a gout attack. Don't test it too soon after having an attack. Another test that we can do is an X-ray to rule out any other causes, but also, like we said earlier, with chronic gout, we can see arthritis, and specifically with gout, there's going to be a Martel sign that's kind of a rat bite lesion that's very specific for gout.
And there's also other imaging, but they're not done as frequently. They're not also as easy to get as an X-ray because oftentimes doctors have X-rays in their office, so they can just send a prescription.
Acute gout treatment. When you come to the office with a flare-up, here's what we can do for you. Number one is NSAID. We can prescribe medication that is similar to ibuprofen, naproxen, indomethacin, but if you do have kidney disorder, it's not recommended, or even like gastric ulcers.
The other thing also that can be done is to use colchicine. Colchicine is a medication that's especially helpful in gout because it decreases the chemotaxis. So basically that the cells are going to be going into the joint. And so there's going to be less of that. So less inflammation in the joint.
The
in
neutrophils,
general. Exactly.
The next one is steroid.
Yeah.
So steroid, you can do either pill by mouth. We usually do a short course. It's about like 6 days and we do a tapered dose. Or we can always inject steroid directly in the joint. This one, I know it sounds scary. It's painful even though we numb the area. But it's the one that gives you the quickest relief.
Yeah. Other thing also that we're gonna recommend is gonna be to rest the areas by not walking too much. Really gonna help. But then also some type of shoes are gonna be helpful more than others. Some surgical shoes are gonna help because they're really not bendy. Or you can also add bendy. Or you can also add a carbon foot plate inside the shoe to make it stiffer. Other thing also is going to be to elevate because of the inflammation, the swelling, and then ice. So ice, so can be,
It's controversial.
It's controversial.
Yes.
Because it's going to help to decrease the inflammation. Yay, great. Less inflammation, less pain. But then the issue, like we mentioned earlier, lower temperature can increase precipitation of
the crystals. Yeah.
And then, you could have more inside your joint, which is not great either.
Yeah, even that book finds it controversial, but yes. Personally, my patient who have tried ice felt more pain while having an acute gout attack, so usually I don't recommend it.
Yeah, me neither. Usually I don't recommend it. Quick pause. If this video is helping you, please like and subscribe. It really keeps us motivated and we love the support. Now let's get back into it.
Chronic gout treatment. The goal is to decrease the uric acid and it's done with medication. I don't prescribe it. I refer my patient to like rheumatologist or primary care doctor. The first class of medication is medication that will decrease the uric acid production, like allopurinol. And the second class is the one that are gonna help the kidney get rid of the excess uric acid, like probenecid.
And there's a third class of medication, which is kind of new. Its name is Krystexxa. And this is when actually there's like a lot of accumulation of uric acid ever in the body for gouty tophi. The patient I mentioned actually earlier that I had met in the hospital all those years ago that had like, gouty tophi everywhere. This is what he went on, came to see me again. And then he had no more anywhere. It was like such a big difference. So he was telling me his story that he actually had Krystexxa multiple times. This medication, it's not something that you take orally. It's an IV medication. So you have to go usually to an infusion center to have that done.
Oh, another thing that can be done for tophi, in some cases where the tophi takes so much space, it can compress on nerve and be really painful. We can do some surgical decompression.
Krystexxa is going to work well, but it's going to take some time to do it. But then if there's something that's really causing a lot of discomfort,
acute, really painful,
surgery is going to help. And then also surgery sometimes is needed in some patient, like my patient, that had unfortunately bone involvement and then also bone infection that needed an amputation. But that doesn't happen often at all.
Yeah, it's rare.
Now let's talk about gout-friendly diet. So basically what to eat and what not to eat. So we don't want to eat too much purines and we want to have an anti-inflammatory diet.
We recommend for you to eat more cherries and berries,
leafy greens,
oat, brown rice, or quinoa,
low-fat dairy,
nuts and seeds,
lots of water,
and coffee. Yeah, it can be helpful. Try to avoid organ meats like liver,
beer,
shellfish,
high fructose drinks,
sugary foods,
and heavy alcohol.
We hope you liked this video and it helped you. And don't forget to get your reference guide on gout-friendly diet and also on what to avoid. It's completely free and just click the link in the description to download it today. As you gather from this video, gout is really painful, but it's also very treatable. So now you have all the information to know what's the best treatment for you.
If you like this video, please hit the thumbs up and then subscribe to the channel for more foot and ankle tips. We also want to know what you want us to cover next. Drop your requests in the comment section and we'll see you next time. Bye.